All right, great. Well, hi, everybody. Welcome. Happy to see you here for the Data Use and Visualization for Infection Prevention and Control workshop series. Today, we are engaging in the first session of 3 sessions, and we're going to be talking about data aggregation and analysis. So I'd like to start first by introducing myself and we public health and my colleagues here, and then we'll also take a little bit of time to get to know you. So my name is Jennifer McKeever. I am the founder and managing director of a consulting collective called We Public Health, which stands for Women Entrepreneurs in Public Health. We have been operating for about 5 years now, and we are a collection of 40 independent consultants across the country who are coming together to share our strengths to support people and organizations who are building a more just and equitable world. And so we form teams to bring our best assets to our clients to advance all kinds of public health issues. We have had the pleasure over the last 3 years or so of working with NACCHO on a number of infection prevention and control projects, and have really had an opportunity to get to see the work that you all as local health departments are engaged in. And I personally have a long history of working with health departments. For over 15 years, I provided technical assistance support to local and state health departments all across the country. I have previously worked at the Louisiana Department of Health, and I'm presently based in Houston, Texas, where our consulting organization is headquartered. So let me set the stage a little bit for what we're doing over the next, I guess it's going to be 4 weeks together. We'll have 2 more sessions after today. So today's session, we're going to be really looking at data aggregation and analysis. So working with the multiple types, different data sets, there's 756 million of them that you might want to use to inform your infection prevention and control work. And what are some options to take that data, work with it, aggregate it, analyze it in a way that is going to help you take a health equity centered approach to infection prevention and control. So that's where we are today. And then as we move through the series, we will start to focus more in the next 2 sessions on data visualization. I know a lot of you are here with a keen interest in data visualization, and we're really going to get into that in sessions 2 and 3. So our sessions run every 2 weeks, and the next one will be on June 11th at 2 o'clock Eastern, and the final one will be on June 25th, also at 2 o'clock Eastern. So let me tell you a little bit about the learning environment that we would like to create here. Right now, I see 3 faces, and those are the faces of me and my colleague Mary and Erica, who are going to introduce themselves in a moment. And we would really like to encourage you all to come off camera as we kind of get rolling. And the reason is it really helps us get to know you. It helps us, especially in this environment where we're going to be talking you through pieces of data, like you're going to have to go to your own computer and download something and look at it and be moving pieces of data around. It's very helpful for us to see your faces to kind of understand, are you getting it? Are you following along, or might you need a little additional assistance? So in that regard, we hope that you will, as we go forward, share your camera and your beautiful face. We're a very come as you are kind of group. I wish I had a little bit more polish today. It just didn't happen, and so we're rolling with it. If you got to grab lunch, go for it. If you got to grab breakfast, wherever you are, that's totally fine. Just please, feel free to engage with us. We want you to take care of you. during this session. It's kind of a weird time in public health right now. I don't think that's any secret. And so we are going to offer you a break midway through, but if you've got to get up and get coffee, please feel free to do that. Just a couple of things we want you to know. One is that we are going to be walking through a stepwise process, which means we're going to do step A and then step B and then step C. And so if you're missing pieces of that, it'll be a little bit harder to catch up later. So just be aware of that flow of things. And then, again, also there will be a break about halfway through. We'll give you some time to turn off your cameras and do what you need to do at that time. So if you can, go to your Zoom square and if it doesn't already say your name, if you could put, you can right click on the three dots or click on the three dots and rename it. If you would just add your health department name behind your name, that'll also help us see where you're from. And I just want to give a quick shout out to Ashley, Bernard, and I can't see your name, but my other friend who's on video. Thank you for setting the stage for us. So last thing I want to share with you all is the help button. So Mary Carney is going to raise both her hands in a wave, double hand it, Mary, so they see you there. See Mary in her blue shirt and purple background. She is going to be your technical support here. So if, as we're working through the rest of the sessions, if you have an issue or you get stuck on something, send a chat to Mary. She's the person that is going to try to help you work it through. If for any reason you end up needing help after the session, we can, offer that too. I'll give you instructions on that. So hopefully this will be a comfortable environment for everybody, and we're glad to have you here. All right, so let me now introduce our trainers who are here to help you learn about data aggregation, analysis, visualization, and all that fun stuff. So let me allow Erica to start, and then Erica, maybe you can pass it to Mary.
Sure. Thank you so much for that introduction. Hello, good afternoon, everyone. My name is Dr. Erica Horn. You can call me Dr. E or Erica. All of those are fine. I have a doctor of public health with experience in behavioral science and health education, as well as certificates in behavioral epidemiology and health education and promotion. I've done work for over 10 years in public health, working with data visualizations at the state level and at the local level. I'm working now in the community level, and I also have my own consulting business as well, and really excited for all of the things we're going to get through today. And please, as Jennifer said, it is going to be a lot, and we're just here to help you get through it step by step. So if you do have any questions, please don't hesitate to raise your hand, take yourself off mute when we get to those steps. And looking forward to getting to know everyone throughout these sessions. I'll hand it over to Mary.
Okay, hello everyone. Good afternoon. I'm Mary Carney, and I'm joining you from Syracuse, New York today. I work with We Public Health as a consultant and collaborator. I also teach epidemiology at our local medical university, and I've been working in public health for 20 some years and really have focused in on data visualization and working with data as an evaluator and researcher quite a lot in the past decade or so. So I'm excited to share with you over the course of this series. You won't hear from me as much in today's section as you will in 2 weeks, but I really look forward to engaging with you all in the chat, in the breakout rooms, and throughout these sessions. So thanks for being here.
Awesome, thank you, Dr. Erica and Mary. All right, so now you know who we are. We want to take a little minute to get to know who you are. So we asked you a few questions in the registration when you signed up for this session. And so we want to just let you know who you're in the room with right now. So we actually had about 70 people that tried to register. 50 people, we set the limit at 50 registered, and we've got about 26 here. So I'm hoping people aren't having a technical issue, which I'll go check out in just a minute. But of all the folks that signed up, we had participants from Ohio, Texas, Illinois, Nebraska, California, Florida, Wisconsin, New York, Oregon, and so forth and so on. You can see the states listed here. Ohio, obviously, coming out front with 8 people who registered, and Texas coming in second at 7 people who registered. So we're glad to have great representation here. In terms of the type of role that you all have indicated in the registration form, the most common role was epidemiologist, and that included straight up epidemiologist as well as epi supervisors or epi managers. We also had a few folks who identified as nurses or nursing supervisors. We had a community health worker, a program manager. Some of you specifically have infectious disease or healthcare associated infection, HAI, AR, antimicrobial resistance in your actual job title. I think 1 or 2 folks had preventionist in your job title. We had a fellow, a director. And so really a broad array of folks who are touching on infection prevention and control from, various lenses and roles within your health department. So we also asked you a couple of questions about your experience level and familiarity with some of the topics we'd be covering throughout the series. And so the first question we asked you about was your not just experience with data collection and analysis, but your experiencing managing and analyzing large and different data sets. And quite a lot of you have a good bit of experience. And so, between 15 and 20 who responded said that some would call you an expert. So I'm going to let you know right now that is meaning that we would love for you to chime in with any knowledge, wisdom, experience that you have to share. We are all kind of learning alongside each other. And so want to make sure that you have the opportunity to jump in and share your wisdom with your colleagues as well. We have a few folks who consider themselves beginners, and then the majority of folks indicated having a little experience. In terms of experience with data visualization specifically, there are fewer people that felt like somebody might call them an expert. There are, again, the largest number is people who have a little or have some level of experience, and then we have some beginners in the room as well. In terms of what you're using to do that data visualization, we asked you all an open-ended question about what tools are you using, and as you can see, Excel was the most mentioned tool, followed by Tableau, Canva, R, SAS, and Power BI. I found it interesting that nobody listed just straight up AI as a possible tool, so that might be something worth exploring a little bit later in our sessions. So it's great to see that Excel is predominantly what folks are using, because we know sometimes we can do these types of sessions where we use a really sophisticated software and it's just not up for everybody's budget or skill level. And so it seems like Excel is a pretty good baseline for us to be working in. And then we also asked you about your knowledge of data equity principles. And again, we see in this case, the largest majority of folks had some level of knowledge. A few had very little to no knowledge, and some of you had felt like you were very knowledgeable. Lastly, we asked you if you could walk away from this series with one thing, only one thing, what would that be? And what we heard is, some general themes around just feeling more confident, just getting more practice in like working with data and or visualizing that data. Um, Not surprisingly, a number of you wanted to make sure that the information you're presenting is interesting and informative. That also included, kind of jumping down the list, some folks interested in understanding how do I tailor the data and visualization to the audiences that I'm sharing the information with? How can I use it to gauge the impact of the program I'm having? How can I consider health equity in the data that I'm looking at? And so lots of things that y'all want to get out of the series, and that's great. So the good news is you're in the right place. This is the right place for you to be, if you recognized yourself in some of that information I just shared. And we also want to say that because we have this varying level of expertise available among us, those of you that are more advanced in your epidemiology and analyzing complex or multiple data sets, you'll find that this session might be a little bit more basic for you, but moving into the sessions 2 and 3, you'll get more kind of ability to practice with visualizations. Likewise, for those of you that are just beginners, if anything we cover today is going over your head or you're feeling a little lost, again, I will ask you to reach out to Mary Carney, who will be available to you in the chat at any time to provide technical assistance. So that's who's in the room, but now we're actually going to ask you to share. And I will encourage once again, as we take a minute to start hearing from some of you, getting to know some of you a little bit, if you would be so kind as to pop on the video and let us see your face, we'd really appreciate it. So Erica, I'm going to go ahead and pass it over to you to walk us through this intro exercise.
Awesome. Thank you so much, Jennifer. And so we are at the place where we know who all registered and who's in the room, but now we want to get to know a little bit more about you. So in the chat, if you would, we'd like everyone to please let us know what you would like others in the room to know about you. It can be something fun. It can be something related to your work. It can be related to your family. If you have pets, a favorite color, anything that you would like others to know about you. And then what is one thing that your community is known for? So I know we're all in our different respective areas, but there's something that when people hear the city or the county of Leon County, this is what they think of. So what's one thing that you would like others to know about you here? And then one thing that's known for within your community. And so I'll let you guys write that in the chat. If anybody wants to come off of the chat, come off of mute, we can go ahead and do that as well. So for me, I'll start off with myself. What's one thing I would like people to know about me? I would like people to know that I am both Jamaican and Panamanian. So I embrace my Hispanic and Caribbean culture in a lot of the work that I do. It shows up and I'm able to be a voice in those spaces because I represent both Caribbeans and Hispanics. And one thing my community is known for is currently, I didn't say where I was from, so I'll say where I'm at now. I'm currently in Florida. And so I would say my community is known for palm trees if you're from South Florida. Okay, I see everything's coming in the chat. This is great. Oh, this is nice. Christina, if you could come off mute, could you tell us about this Hyrox you're training for? I think that sounds very interesting.
Hi, everyone. My name is Christina Obear. I'm the Northeast Texas Public Health District Data and Grant Coordinator. And here in Tyler, Texas, we have an F-45 gym, which is kind of like a It's kind of like CrossFit's cousin, if you know what CrossFit is. And so CrossFit's very random, but a high rocks is you run 800 meters and then you do a ski erg, and then you run 800 meters and then you do walking lunges. And so you run about 5.5 miles while doing a workout, and you can do it with a partner. And it's really exciting to just have a community that does health outreach, but then also like you can be a part of and be competitive. And then we also have a bunch of parks out in East Texas as well to where we do our trail runs.
Thank you so much for sharing. That's very interesting. I've never heard of High Rocks before, and now I think I'm going to look into it. That sounds really interesting. Is I'm going to still be reading through the chat. Is it Jonna? When you say that you all had 7 tornadoes at once, that is almost intense. And your only child leaves for college. How are you feeling through that? Anyone else wants to come off mute, you're free to come off mute. And I'll still be calling on a few people to share if they're able to at the moment.
At the moment, I think I'm glad she's leaving. I heard she's in the stage called soiling the nest. So, but I'll be really sad without her.
Thanks for sharing, Jonna. Oh, Tanya says her dog and her cat do not get along. And your community is known for artscape. And I would say, which time of year do you think, or what is it about the arts festival that is like so amazing that draws everyone to it? What do you think comes to mind? Welcome, Susan. Susan's in Idaho, known for potatoes. Definitely heard of those. We like potatoes. I actually had some yesterday. And Geraldine's from the Philippines. I love that. Passionate about public health and how it can change the lives of those and the population. Thanks for sharing. Is it Adashina? You like listening and learning, and your community says strong Museum of Play is a nice place to visit. What exactly do you do? Or can you do at the Strong Museum of Play? Did I say it right, Adashina?
Oh yeah, I'm actually a public health fellow 3 at the Morrow County Public Department of Health, and I like listening and learning from people and even nature. And I think the Museum Strong Place is a very nice place to visit in Rochester, the county. So I think it's one major thing I could pick out, probably best known for. Thank you.
Thank you. Thank you for sharing. And I'm still trying to get through. Everyone's doing awesome in the chats. Bernard, you love matcha. Yes. And struggling with the global shortage. What is it? Also has a memorial for the past yellow fever outbreak in Ybor City. That's interesting. You mind sharing a little bit about that if you can?
Sure. See if I can pull up a picture. Essentially in Ybor City, which is a historic district in Tampa, Florida, it was impacted, I think, in the 1800s, early 1900s by yellow fever. So the whole southeastern region of the U.S. was endemic with yellow fever. They would actually hold people at gunpoint coming from train cars and send them back to where they were coming from to not introduce yellow fever. But it's kind of a tale to make sure that we keep on top of the mosquito-borne diseases so we don't have to deal with yellow fever and malaria again. But there's a memorial in a cemetery in Ybor City that commemorates the people who lost their lives during this big yellow fever outbreak that took place in Tampa, Florida, when it was a major port city during that time.
Thank you so much for sharing. This is all great. Emily's in Southern Illinois. I do apologize if I did not get to say everyone's name, but thank you all so much for just sharing a little bit about you, about what your community may be known for, and just sharing in the chat. I think it's a great way for us to kind of know who we're going to be interacting with over the next few weeks as we get ready to go into this series. So we'll go ahead and get started with moving on to session 1. So next slide, please. So here we are, session 1, data aggregation and analysis. As Jennifer mentioned, this is the first part of a 3-part series. Today's session may, as mentioned, there are a lot of people who have some experience or who may have a lot of experience with this information. We're going to start very ground level because we want to make sure that we can get everybody kind of up to the same speed as we move into the visualizations over the next 2 series. And so today we're going to start with just a basic overview of data aggregation and some basic analysis. Next slide, please. And so throughout today, we're going to go through our objectives for our session today. We're going to have an overview of some national data sets as well as some local data sets. We're going to discuss navigating data across geographies, and then some health equity informed indicator selections. Can everyone still see the screen? Okay. And then we're also going to do a case study for everyone all together before we end out today. And then we'll do a review of what is going, we're going to do a review, a recap of what we've done today and to set the stage for the next session. Next slide, please. So today's objectives are 1, to access and navigate key national data sets. And so the data sets that we're going to look at are going to be specific to infection prevention and control and how you can use some of them. There are a plethora of data sets, so we're not going to go through all of them, but we are just going to highlight a few of them so you can navigate how to go onto the website, how to download some of them. Then we're going to work with data across different geographic boundaries. In these examples, I will be demonstrating how it's going to be done first and then give you the opportunity to practice it with question and answer just to make sure that everyone's able to understand and they can actually do it themselves. And then the third objective is to select meaningful health equity informed indicators for IPC priority settings. And so what that means is we're going to discuss some different things to consider when looking at measures and indicators that are available in data sets. And you all will have time to practice discussing what makes it meaningful, why it is important, and which ones are important for the work that you're doing. Because we have people that are working from all different areas, what's important for me may not be important for you in your work. If I'm working in hospitals and you're working in long-term care facilities and you're working in primary care offices, we may have different needs or different indicators that are more important to us. And so what we're going to do is kind of discuss why they're important and how you can properly be able to talk about what's important for the work that you're doing. And then our last objective for today is to apply some basic aggregation techniques to identify hotspots or your high-risk populations. And we'll do that in our activity through zip codes. Next slide, please. So before we get into our national data sets, once we looked at who all were going to be in the room, I decided to do a quick scan of what was available, the different data sets that may be in your respective states. And so here are some data sets that I was able to find that are useful or that others are using in IPC. And these are specific to your individual states because in addition to the national data sets, there are things that you all are collecting, you all are watching, you guys are surveying yourselves that may be reported to the national data sets, or that may be specific to the role that you're in your specific health department. So for example, in Arizona, there's the public health data portal where you're able to locate some additional features and measures. In Florida, we have the Florida Health Charts. You can use that to look for a wide array of measures and variables for whatever you may be interested in. In Ohio, there's the Ohio Disease Reporting System. In Texas, the Public Health Informatics and Data Exchange Unit. Nebraska has the ICAP. Illinois has the National Electronic Disease Surveillance System, which is INEDS, in New York and Oregon and so forth. I just want to know, by a raise of your hand, or has anyone used any of these in their respective states already, or does anyone use them? Okay, I see a hand raised. Emily, do you mind coming off and sharing which one you use and what you've used it for?
Sure. So in Illinois, what you have listed there that's our reportable disease case surveillance system. So all of our individual reportables go into there. That's where we, after we do our case investigations, that's where we enter all the symptom exposure, all of that type of data. So we use that system constantly. And probably, I guess related to this group, the most recent thing, and I can put a link in the chat. The most recent thing that we've used it for is we recently started doing a quarterly multi-drug resistant organism report, where we're pulling a lot of those data are coming from that case system, along with some data that we track internally. But so we're in that quite a bit.
Awesome. Thank you so much for sharing and for sharing what you guys are doing. There may be other states who are interested or are curious, and they may not have known that may be a possibility. So thank you for sharing. Yes, and Christine in the chat says, yes, she used PHID in Texas. So yes. And so as we're looking at these statewide data sets, I know in everyone's respective states, this is what they may be doing their initial reporting to, as Emily just mentioned, and that's how they're doing their statewide work. But when we go into the national data sets, some of that information is shared up to the national level, and some of it is not. So we're going to go to the next slide, please. Thank you for sharing, Bernard. Do you guys use Merlin also in addition to or in lieu of
We do.
charts?
We use Merlin for our MDRO case investigations. I guess what I meant by it's too aggregate and community focused. We're not interested in CAUTIs and CLABSIs at the local level. That's really more like state hospital indicators. We're really needing to know facility level infection prevention metrics so we can identify which facilities are needing more assistance, just more granular and local level data. It's not something we have a whole lot of in Florida yet, but I know our state HEI team is working on stuff.
Yes, thank you for sharing that as well, Bernard. And thank you for sharing in the chat as well, Emily and Sherry. So here we just want to know, which data sets do you currently like to use for infection control if it isn't one of the ones that were previously listed for your state? And what is it that you do like about them? I know Emily shared about their process in Illinois and how now they have like a quarterly system where they have a quarterly report that can go out. Does anybody else have any ideas or any suggestions or anything else they like about the system that they are using that may not have been listed or is listed? Bernard did also share about why there is not a fan for Florida charts in Florida as well. So that's also an example. Bernard also mentioned that the MDRO surveillance needs a lot of work also, which it does.
If I could elaborate on that briefly,
Yes.
I think it comes down to identifying what our goals are, right? If you're using a regular reportable disease surveillance system as like a registry to capture people who are colonized with MDROs, most are fine. But if you're wanting to look for outbreaks and clusters and kind of figure out which facilities are experiencing cases, then traditional disease surveillance systems may not be designed for that purpose. And it leads a lot of local health departments to have to kind of create their own stuff in Excel. And, you know, I think it just comes down to the broader discussions of what are we wanting to achieve, and then kind of co-create systems that can better achieve that. Sorry.
No, thank you so much. I love that you mentioned about how individually you may have to make some additional changes. And so as we start talking about the health equity related indicators, we'll also talk about, you know, what potential gaps may be missing later on. Today, you kind of are keeping us on track to make sure we get there, but I think that's a great start to the conversation and thinking about what are some things we need to think big picture. What is the end goal? So when we talk about future of collecting this data, we can make sure that we're putting ourselves in a position to collect the right data to achieve the right purpose in the end. So thank you so much for sharing. Does anybody else have anything they'd like to add about the data sets they may like that they are using, or what they do like about them or do not like about what you're currently using or what you have access to? All right. Well, if nothing else, then I'd like us to switch gears. So we talked about what we're using locally. We're going to go to our next slide, which is going to talk about some of our national data sets that you all may be familiar with. And so I'm going to read about the 4 that we're going to highlight today. And then we're going to share our screens to kind of walk through an example of downloading data from each of the 4 of these. And so the first one I'm talking about is the CDC National Healthcare Safety Network. It tracks HIA, antimicrobial resistance, and antibiotic use. It's mostly used in your hospitals or nursing homes and outpatient facilities, and access may be restricted to participating facilities and public health agencies. As some of you know, sometimes you have to have a certain clearance or a certain agreement in place. So all data, just in general, when you do look at the national data sets, all of the data isn't going to be available for every single state. Some states have an agreement to share their information. Some may not have signed the agreement. And so when we go to look into these national data sets, you'll notice some may be useful for you and some may not. So it's actually just taking the time to figure out which ones are going to be helpful for you. Another one that we're going to talk about is CDC PLACES, and we'll get really familiar with that data set throughout today's session. It's a model-based estimates of chronic conditions, behaviors, and prevention. It is downloadable in multiple forms, either by zip code or census tract or county or place level. And so we'll use that throughout today's session. And then we're going to talk about the American Community Survey, which is full of demographic and socioeconomic data, and it's specific to small area geographies. When Mary walks us through, she's going to show us just a few snippets of how we can get down to more granular levels on that data set. And then also the Social Vulnerability Index. And this combines 15 different indicators to help identify vulnerable populations. And I'll also show you how you can download the actual document with the documentation about what the social vulnerability index is used for. So in essence, it looks at your socioeconomic factors such as poverty, lack of transportation, crowded housing, and it also looks at those that are going to encounter hazardous situations. So hurricanes, tornadoes, who's more at risk, and putting those two together, how do you determine which areas are going to need more support after or before natural disaster may occur? So they have different purposes. You can find different things throughout them. And so I'm going to start first with the NHSN. And please let me know, either by raising your hand or shaking your head, if you can actually see this slide. Okay, it says, okay, I'm seeing thumbs up. Thanks. Thank you guys so much. Okay. Thank you so much. And at any time, as mentioned, if you do have a question, feel free to come off mute. Feel free to place it in the chat. Feel free to ask so that we can make sure all our questions get answered. So the NHSN, basically this website here, you can look at the different report categories. I know a lot of people mention HAI. So for example, you can, the link is going to be placed in the chat for you as well. And if you want to, you'll be able to save these links and bookmark them for future use if you ever come across, or if you need them, or if you know someone that you're working with that says they may need these data sets as well. But this is the quick way to get to it. So for this, I'm going to click on HAI. And here we see on this page, it shows the different current available data set that is currently available with the restrictions that are there. And one of the key things that I want us to take away is when we're downloading these data sets, because we're working in Excel today, we're going to be downloading CSV files. So that is comma separated variable files, so CSV. And for example, if we wanted to say, what is currently available? Here you have your 2018 to 2021 currently available data sets. These are already in Excel, so they work out, but you can click on the report and then you'll be able to save it. So this is just one of the options within the NHSN. You can also find reports for long-term care facilities that already have these contracts, or your healthcare personnel influenza vaccination programs. So this is one site where you can find a lot of these downloads available. The second one I'm going to go through is the Social Vulnerability Index. And this one will be placed in the chat also. So with the Social Vulnerability Index, basically overall, like I said, it goes through all the different factors and variables that area may be dealing with. It's going to calculate an overall vulnerability score, looking at socioeconomic status, household characteristics, racial, ethnic minority status, and housing type and transportation. And it's going to look at what it's been over time, because it takes in 15 different census together. And when you want to download your data, underneath related pages, there's this button for data and documentation download. This is where you will select the year you're looking for. It goes back and it shows you how often it's taken. You're going to select your state if you want to, or you could do the whole United States as a whole. But I'd highly encourage you, you can pick the state that you're in to help find your data. And then you're going to select either by counties. If you're at the state level, you may want to do county-wide data, or you may want to do the zip code areas. And then that way you can see which zip codes may need more information or support based off of the zip codes. So you have that choice. When I was mentioning here, this says file type. For the purposes of what we're doing, you would want to download your CSV files so that all the data is coming down into a table. And that way you can have this table with data that you can then manipulate and you can do data visualizations with. So I'm going to stop sharing now. And Mary's going to share quickly about the American Community Survey, ACS, and then PLACES.
Hi, can you all see my screen now? No?
It just went away.
Okay, I will try again. Who sees it? Thumbs up?
We can see it.
All right. Great. If you're like me, you spend way too much time looking at data that the Census Bureau collected in some way. We could spend a long time on this, but this is the landing page where you have all the documentation about the American Community Survey. And I typically recommend accessing it through data.census.gov, one of the links on that page. Easiest way is to put in a topic that you're interested in data about, and then go to the filters button over here on the left. And you can filter for American Community Survey if you want to limit your data to one data set. I usually end up looking at 5-year estimates because those are the type of the 5-year estimates are what's available for rural communities and smaller geographies. So you can click on data profiles or detailed tables or any of these choices. And when you X out of it, you'll get a much more refined filtered list of table options. So if you select a data set, I'm sorry, I'm going through this very quickly. You then want to filter for geography. You could do that from the same filters button or from the geos button up here in the header. And there you can filter for census tracts within your county. Just picking one here. Select all census tracts within that county, and you'll see that the table automatically refreshes and gives you the data that you want. And then you click on the 3 dots here at More Tools to go and download the CSV file after you've customized it to be exactly what you want to look at. So that in brief is the American Community Survey. However, we're going to spend most time today on CDC PLACES. So this is the last national data set we wanted to show. Jennifer kindly is putting links in the chat. I see them there. So if you received an email before today, you should have received 2 CDC PLACES data sets from us already. You have a choice here. You can ignore what I'm doing and just watch along and use the data that we sent you if you have it in your email. Or you can follow along if you want to, see the steps for downloading it yourself. The link in the chat should direct you to this page you see in front of you. And this page has lots of direct links to get county, census tract, place, or zip code level data. However, the best place to grab data is to go, I think, to the data portal link, which you can always find in the related pages sidebar over here on the right. So if you're following along, click on Data Portal, and in the Places Data Portal, you should click on the current release data, which will send you to a filtered page in the CDC's Places Data Portal that just has the released data from 2024. And the top link here is the link for the county level data set. So it's the Places Local Data for Better Health County Data 2024 release. If you scroll down, you see lots of other options, and you can also find that large zip code file, which we sent you. If you click on the county data set, that top link, you'll get to this page, and we're not filtering it at all for today's exercise. We're downloading data for all the counties. So you just click this export button up here on the right, and you should get that CSV file if you let it stay at all the same default options here. So download file, CSV, all data, click download, and you'll get your data set. So I'm looking to see if there are any questions about that before we move on. Thumbs up if you've got a data set you can work with today. Okay, all right. I think we're ready to go back to you, Erica.
All right. Well, now we're going to get into the part of the session where we actually get to start working with the data. So before we start working with the data, one thing I like to do is to create a folder so that we can keep all of our data organized. So I'm not sure how you do it in your respective areas. Most times you have your data folder. So what I want everyone to do, this is going to be really simple. On your desktop, you're going to create a new folder and you're just going to name it practice data so that you'll have it for the training series. Everyone should have received the data files in their email, or just walk through that step with Mary on how to download the data file, because that's what we're going to be using next. If you have any questions, go ahead and share them in the chat, or you can ask Mary. But I want to make sure everybody has the data file. Once your practice data folder is created, then within that folder, I want you to create 3 subfolders. So your first folder is going to say raw data. Your second folder is going to say clean data. Your third folder is going to say visualizations. And once you've done that, I want to place a thumbs up so I can see how we're moving with time and see how everyone's doing, if anyone needs any assistance. Or if you need assistance, please raise your hand and we will help you.
So Erica, if you're people like me, I'm looking for the county data,
Yeah,
not the zip code data. Is that right?
correct.
Okay.
That is correct. The county level data. So the data will say places underscore local data for better health underscore, and it'll say county. So you want the one that says county, not zip or ZICTA.
So maybe, yeah, there's a question from Bernard, and then I think it'd be great if we can get a check-in from everybody, hands up, note in the chat that we're all kind of tracking, but I'll let you go ahead with Bernard's question first.
Yes, okay. So the county level data is on the you guys have Google Drive blocked. You should be able to get to it from this link, which is the places. So this is in CDC Places where you're going to download the county level data. Actually, that's ZICTA.
Actually, Erica, I think you shared the link to the zip code tract area file, but I just put the the direct URL to the CDC Places county data in the chat.
Thank you.
No problem.
You can still save the ZICTA because you'll use that later, but we're doing county level right now. So does everyone have the county level data where they can hit export and they have a CSV file, or they may have it from the email?
So let's, I'd love to see some thumbs up signs, some notes in the chat, some indications.
You could put got it or have it in the chat. I see
Okay.
4 hands. I see 4 thumbs up. 6.
All right, Ben, Ashley, Geraldine, how y'all doing? Okay.
Kaylin's got it. Tanya, okay, Forrest has it.
Becky, Tyler, Sherry, Trenton.
Got it. Awesome, Bernard.
All right, y'all. Awesome. Thanks for helping us track. Mary is your go-to person. If you are still having an issue, send her a chat and she'll do what she can to help you.
Yes. All right, so once everyone has their CSV file open, and it may take a little while to open, I do recognize it is a large file. The first thing we're going to do is we're going to save this file, the raw data file, into the raw data folder as a CSV file. So once your Excel is open, you're going to hit your file button, go to save as, like you normally would save the file. And for file type, it should say CSV. And you're going to navigate to the folder that you created on your desktop that says raw data. And the reason we're creating or saving it in a separate folder as the raw data, we do not want to manipulate it in the CSV format. We only want to manipulate it when it's in its Excel format because we're going to change it over to Excel. This will help if per se, you're doing data, you're working on a visualization. Let's say you happen to make a mistake or you delete something on accident. You can always pull your raw data folder back out, and you can always pull out that data set and resave it as an Excel and start over. And so as long as you save the raw data as its own file in its own folder, that can almost turn into your raw do not touch folder unless you made a mistake and you need to restart over. And that'll alleviate you from having to always go back to the website to re-download the data and re-download your data sets. Does everyone have it saved in their raw data folder? You can do a thumbs up if you have it saved. Awesome. Thanks, Geraldine, Elise, Emily, Ben, Janita, Kaylin, Forrest. Okay, Tanya, Braden. All right, so everyone has it saved. Now with it open, we are going to save it now as an Excel file. So the same file that's open, you're going to go to save as. You're going to navigate to your clean data folder. So your clean data folder is the one you're going to save this one in. Now, when I say rename with a generic file name, that is up to you, your preference, what works for you, your department. If this is a shared drive that multiple people will be using, you may want to use something that's common that everybody will understand if you guys have a naming system. And so you can name it, for example, places_county to make it easy so you don't have to deal with the long name of the file. I also recommend that you put a underscore with the date that you're saving it, so you know what the date is looking like on that specific date. So for example, I would name mine places_county_05/28/2025. And that way I know what day I saved it and I started the manipulation for this specific data set. Once you saved it and you have it ready, just put another thumbs up, and then we're going to move on to actually doing some movements.
And Erica, just a time check, we're at 3 o'clock.
Thank you. All right, so I'm going to share screen for the demonstration we're going to, yes, I'll share screen for the demonstration we're going to do, and then I'm going to let you guys practice it. It should not take long. And this is still very high level. Once you see my screen, please thumbs up or type in the chat so I know you see it. Okay. So what I'm going to do is here, let me clear this. Everyone's data set should look like this. It should be across the first row should be all of your variable names. And then you'll have your year in the first column. State should start with Alabama all the way across. So everyone should look just like this. What we're going to do is check to see how many records are present after we choose our state. So I want you to go to column C or to column B, whichever you prefer. For me, I'm in Florida, so I'm going to select Florida and click OK. Here, you'll see only those that are Florida show up. And in the bottom left-hand corner, you see 4824. So that's the number of Florida records out of the total 240,886 records. Okay? So that's a quick way to read how many files or records you have out of the total. You're going to let us know how many you have in your state. Then I'm going to name another sheet. So you see this plus sign, or you might have one that just says sheet 1, 2, 3, 4, 5, where you're going to rename, you're going to create a new sheet, right click it, and rename it. I'm going to name mine Florida. You're going to name yours your respective state. This should be empty when you first start. Oh, already happened. Florida one. From there, this is just one way you can do it because I know there's multiple ways to do it. I'm going to copy all of the Florida data to put it in its own sheet or tab. A quick way to do it is the top left-hand corner above your number 1 and to the left of the letter A, there's this little triangle and a plus sign. When you click on it, it highlights the whole sheet. And that's a quick way to highlight your whole sheet. And it's just going to highlight those that I've already filtered in Florida. You can do, oh wait, sorry. Control C to copy. And then I'm going to go to the tab that I created. Control V and paste. So only all of my Florida moved over into this next tab. I'm going to go back. Once it's done, it may take a while to transfer everything over. I'm going to go back to my original data set, go to sort and filter, and clear the filter of Florida so that all of my data is back there. Now on my Florida sheet, you should have the same number that you started with on this sheet that you did when you initially filtered it out. And you can easily check that by highlighting the first row. You can do Control, Shift, and down, and you'll see where your last row is at, 4825. But remember, your first row is all of your variable names. So you can subtract 1, and that lets you know how many files you have. And that matches the 4824 from the first file on the first page. So now we're going to go back and share the PowerPoint to let you do the same thing for your state. I know I did it really slow, but you should be able to do that within a matter of like a minute at most, okay?
All right, some of us are a little slower than that, Erica.
Okay.
Maybe a minute and a half.
Maybe a minute and a half. Once you've got I want you all to go ahead and make your own file tab for your state. Once you've done that, throw a thumbs up in the chat or raise your hand, or so we know that we're all on the same page. If you have a question, feel free to ask it. Okay, Emily's done. Okay, thumbs are coming up. Elise, Susan. Thank you, Kaylin. Megan, awesome, Janetta. All right. So we're gonna keep moving due to time. And if you do have any specific questions that that you still need additional assistance with, please feel free to reach out. Thank you, Jonna and Sherry, for tapping in the chat. That if you need any assistance, feel free to reach out to Mary in the chat as well. And so we'll move on, since there are no questions, to the health equity informed indicator selection. And so what we just went through is just a quick basic, how do I get my state's data if you're given a large data set and then you didn't have the ability to filter it. Some of the data sets that are national, you may not be able to filter it before you download it. So that's why I wanted to take the time to go through how you can quickly filter it. You may even have to filter it by different things such as the FIPS code, and you'll know which ones they are for your state. You can find that. So the health equity informed indicators, essentially what you want to do is you're wanting to find data sets that include your social determinants of health. These include, your race, ethnicity, income, education level, housing stability, housing access, health insurance. And you're going to want to look for disaggregation by some of those specific SDOH. So is it disaggregated by race and ethnicity, by age? Is it disaggregated by gender, zip code, census tract? Could be county level for whatever you're looking for. Each of these data sets, specifically at the national level, they'll have a code book or a dictionary or a methodology. When you go to download your data, you'll also see that the code book may be there. These are essential because they help you understand what the national level is saying and how they are defining everything within your code book, everything within the data set you downloaded. As you see in the data that you have across the top, it said variables, but all of those may not have made sense to what they actually mean. And so your code book is going to explain, what does measure mean? What does data field mean? What does the category mean? What is the data source? It's going to explain what all of those mean, so you'll know exactly what they mean when you're going to rename them. This is also important for understanding what they mean, because when you go to rename it, once you've made it in the Excel file, you can manipulate the data however you see fit. And if you need to make it something that's more understandable, then you want to be able to know what it actually meant and what it can mean, so that when others are viewing your data and what you've manipulated, they too can understand what it means. And one of the things that you want to check for when you are looking at large data sets, especially the national ones or even your states, you want to check for what limitations the data sets may have. So essentially, the first thing we talked about was making sure that you have a data set that includes your SDOH. Does the data set you're looking at not include that information? What information is missing? Does it not include income? Does it not include race? Does it not include educational status? And data sets that don't have those can only do so much when you're looking at a health equity informed decision, when you're trying to decide which measures you want to look at. So as we're all working in IPC, we may be looking at infection rates of a certain illness, or what are the infection rates of vaccinations or influenza. If the data set you're looking at does not include age per se, you may not know who's being affected by it. So then, even though you're using this data set, it doesn't give you a clear picture for your specific community, or if it does not have the long-term care facilities or the hospitals. So you want to look at what's not included, and then also which ones are outdated. Sometimes the data sets, if they're beyond more than like 5 years, 10 years, as they're getting older, there may be parts of the data sets that are missing. And even as time progresses, they may be adding new things, as we mentioned earlier about data sets not having all the necessary pieces. And so the last and final thing I want to talk about is organizing and labeling your charts and your folders. Just like I had you guys make a practice folder, a subfolder for clean data, for raw data. You want to do that for yourself within your respective health departments as well, especially if you're working within a team, or if other people have to be able to come behind you. You want it to make it where it's easy for someone to pick up the work that you're doing, and vice versa. If you have to follow behind somebody else, you want to make sure that you all are working and speaking the same language with the work that you're doing. So renaming variables, like I said, to what makes sense, renaming the file name, what makes it easier. Oh, this is the demographics file. This is the data for the infection rates file. All of these things make it easier for you all to make an informed decision on why it's important to have your SDOH chosen or available in the data sets you use. Next slide, please. And so many of you, of course, you have access to the equity framework for outbreak prevention and response, and Mary has posted it in the chat as well. Everyone should have access to this. So in addition to those national data sets and measures, you have community and facility level data and metrics. I know Bernard mentioned earlier, wanting to have access to some of these in the reporting at your different state levels or county levels. If there's some that are missing, this might be a great great conversation to have about making those adjustments to get these necessary metrics. With the health equity, with the framework, it provides the definitions of how they're used in other data sets as well. So they include the SVI, they include the BRFSS, which is another one that's very popular that others are using. But it shows you how these metrics can be used in making health equity informed decision making around what are priorities that need to be addressed and what may not be a priority and what areas need to be tackled first when it comes to making decisions about addressing issues within your respective communities. So the link is in the chat if you don't already have that, but you should have it. And if you have any questions about it, feel free to ask while we're on break. And then we can go ahead and make sure that you understand what they're used for, or if there's anything that you could use them for. In the chat, if anyone uses any of these other community or facility level data metrics, feel free to share which ones you're using. I'd like to see what everyone has access to already. You can share what it is that you are using or what it is that you would want to use, like a need that you think would be helpful for you in the chat.
Bernard, do you want to say more about that? Haven't found the health equity indicators to be of strong predictive value of facilities at risk for outbreaks.
Yeah, when the NACCHO Health Equity Toolkits came out, I think it was last year, we started playing around with the national aggregate data sources, and we were trying to see if we found, at least for our jurisdiction, any type of correlations with facilities in high SVI, census tract or zip codes with known facilities experiencing COVID outbreaks. And we just didn't really see a strong correlation. But it's not to say that equity indicators are not working. It's just we may have to think differently about how to capture health equity metrics within the facility itself. Like staffing turnover rates might be a big predictor for outbreak risk, for instance. And so just doing a quick surface level analysis, we really didn't see the facilities experiencing outbreaks frequently show up in the high SVI areas is just one example. So I think this work, there's a lot more that needs to be done in this area to kind of, how do I say this? Find which ones are predictive for each jurisdiction, so to speak.
Mm-hmm. Yeah, Emily, I wonder if maybe you want to jump in with what you're sharing here in the chat as well in response.
Sure. So actually, I would say for us, literally, exactly what Bernie just said. We just did, as part of the Prepare grant, a lot of analysis looking at, we pulled like 25 different community level variables. And we did, we looked at those against our internal outbreak metrics. And they just didn't seem correlated. Like, I think it's just not direct, like the community level metrics are, maybe they're just not close enough to like what's actually happening in the building. And then we were also running into issues too, where we were, I think there's probably some bias in our outbreak data. While they're reflecting outbreaks that are happening, they're also just reflecting who's reporting outbreaks to us. And I think we do have a lot of facilities that we would quote unquote consider like good facilities or like well-resourced facilities, and they're the ones who report. So they're the ones that it looks like they have a lot of outbreaks. And then we have other facilities that we haven't heard from in, 12 or 18 months. And it's like, oh, it looks like they don't have any COVID problems, but I think thinking through it, that's likely not true. I think there were some reporting issues. So when we've been working on we have been working on a new prioritization framework, and we created like a scoring system, and we ended up using mostly the CMS metrics related to staffing and vaccination rates and turnover that were more directly at the facility level. But we are hoping to do some like facility surveys to ask them specifically, like, what languages do your staff speak? Because I think sometimes that is very facility dependent. And I just anecdotally, we've been to some facilities where most of the staff speak Spanish, and then we will go to another facility and almost all the staff are speaking Polish. And it's not necessarily always reflective of like the surrounding, like their exact zip code. So we're hoping to get some more information like directly from the facilities, and we think that'll help. But it was really hard to like do that type of analysis. It took many, many weeks, and it's we had like 3 people working on it. So it was a lot.
No, thank you so much for sharing. Thank you both for sharing the experience that you guys have had so far. I know we said we're gonna have a quick break. We're about at that halfway point, so we're gonna give everyone opportunity to take about 5 minutes, go ahead, stretch. I'm gonna have a timer going with something in the background, and I'll let you know when we have about 1 minute left. If you do have any questions in the meantime, you can still ask them in the chat if you're not want to get up, but feel free, go take a break. We'll be right back at it in about 5 minutes. We're going to move forward into the next part. We're going to go through some quick high-level aggregation techniques of the data that you all downloaded, which was that county level data. So just like last time, I'm going to go ahead and share my screen real quickly and walk through this example. You're free to walk through it with me if that will be helpful, but afterwards, we're also going to put the instructions on the screen for you to do it yourself. So let me get that up. Here we go. And just put a thumbs up once you see it. Or wave or shake your head so I know you guys can see the. All right, we're gonna see thumbs up. Awesome, awesome. Okay, so I took the Florida data, and you all may have took different states. Some people may have taken Nebraska or Ohio. What we're going to do here is first, we're going to do a really simple summation. We're going to figure out what's the sum of all of the things, the variables in one specific column. We're going to do the average. Like, what is the average? And there's going to be multiple ways to do that. I'm going to do everything through pivot tables initially, so I can show you. So I'm going to go all the way back to the top of my file. So here is my Florida data. You guys are still seeing it, right? I'm going to click on insert. If everyone should see insert. And now if you don't see insert at the top, or if pivot table is not there, one way you can find it is in your search bar. You can start typing the word pivot. If it doesn't show up, I know everybody has different levels of Excel they may be working with. So if pivot doesn't show up in your insert tab, you can type in pivot, and pivot chart should show up. Once this pops up, all you're going to do, you're going to make sure that it says new worksheet. And then you're going to click OK. I like to go from a fresh sheet when I do pivot tables. And from here, on the right-hand side, you'll see those chart fields that can be used. We're going to use the measure of housing insecurity. So you're going to click on the arrow next to measure, and there's a list of all the different measures that are available in this data set. So what I want everyone to do is you're going to unclick select all, and I'm going to click on housing insecurity in the past 12 months, and I'm going to hit OK. Now that it's filtered, when I hit the arrow, the check mark, it shows up on the left-hand side. So now I know that's one of the rows. I'm also interested in the data value type. So I'm going to click on that to filter it. And I'm going to only select age adjusted. That's the only one I want to use, age adjusted prevalence. And I'm going to click OK. Now that I have my type, it's filtered. I'm going to select my data value to be data value. Underneath it is going to give us sum. So this is just a quick way of knowing how to formulate a sum. Now, if I want to actually look at it by county as well, I'm going to go to location name. Here, all the counties are listed. You can list it, you can keep it for all of your counties. If you're at the state level, that's what I would do. And I'm going to select location name so that now it shows up on the side. And now for the age adjusted prevalence for housing security, this is the sum data for every single county in Florida that has data reported. I'm going to change it because the sum is really not telling me much of anything. So I want to look at the average to see what's the average age adjusted. Under the values tab where you have your sum of data value, you can click the arrow, and then the bottom one says value field settings. You can click that button and you can change it if you want to know the count. So let's say I was interested in just knowing how many there were. It's going to show me 1. Okay, that's not really showing me what I want either. What I really realize I need is the average. So I'm going to do that again, and I'm going to select average. And now this shows me the average age-adjusted prevalence of housing insecurity among adults within the past 12 months for each of the counties. And so that is a quick way of utilizing your pivot tables to give you sums, to give you averages. When you click under values and you switch the value field, it's going to give you other options of what you may be looking for. You may be looking for the standard deviation. So this is a quick way to do just quick high level. So now when I'm looking at this information, I'm saying I want to know what the top 10% is or the top 25%. I'm going to go click on where is my from here. So from here, and I'm going to do this instead. So from here, you also see that it gave you an example of a table. So this is a quick example of data visualization that could be useful. When you're in your pivot charts, you can also click on other. Once you have your row labels highlighted, you'll see that conditional formatting became available to click. So I'm going to select conditional formatting because this is going to allow me to look at top and bottom rules. And the first one I'm going to look at is what is the top 25%. So I know it says you can do the top 10 if you're wanting to look at what are the highest. You could do it by percentages. And while it says 10%, I'm going to switch it to say 25% if I want to see where are the highest hotspots available or in my area that has this issue. And so once I hit okay, wait, wrong one. I'm not sure what is going on. There we go. So you're going to, I apologize for that. Going through too many things in my head. Once you highlight the data you're looking for, which is your row B, I have 10%. Let's make it 25%. It's automatically going to change with the percentage. And you can also change it from saying red. Let's say red was bad. Red is a 10%, that's bad. Let's say if you were wanting to look at who's actually doing a good job, because then the opposite could be who's doing good, because we can talk with them about what they're doing and we can find best practices that are occurring in those areas and we can share that with those who may be doing bad. So on the reverse, instead of looking at top 10%, you can go to your conditional formatting again and you could do the bottom 10%. And you could make it 25, but you can also do green. And so this will highlight those that are doing good. You have an option or a choice of however you want to utilize the colors. You can do red, green, yellow. And also when you just want to make sure that it's uniform across your entire organization. So that if one department is using red for bad, the other's using green for bad, you don't want to mistakenly look at someone else's files and think it's the same thing. So when you're making your folders and your documentation of how you want to communicate this information, you just want to make sure that you're sharing how that information is shared. Another thing you can do when you're using pivot tables is right now it has the row labels. We chose to look at housing and security. We can also choose another variable or measure that we think is important. So for example, if you think COPD is important, you can then switch it and add COPD. And it's going to automatically readjust based off of whichever measure you have. So if you're initially trying to look at data and trying to see what's important, you can easily look at multiple different variables this way and see what makes sense. Bring it in a group setting, talk to everyone that's on the team that's making the decisions and see which ones actually make more sense for everyone. And so I'm going to stop sharing now. I'm sure some people walked through it. Some people walked through it with me. So instead of going through it first, what we're going to do is getting started with our case study. And our case study is going to have us walk through the first part of this activity. And so you all are working at health departments, right? There's been an increase in tuberculosis in the state of New Mexico. The state health department has reached out to all of the different directors of the individual county health departments to discuss the increasing trends that they have been seeing. And your director has come to you and they want you and your team to determine which areas need to be addressed first to reduce the spread of the infection and mitigate all that's going on. So to do this, you're going to want to prioritize your outreach by zip code. So your zip code file that you received in your email, you should have that. You can go ahead and open that one up now. The zip code file. And do a thumbs up when you have it, or if you need the link for it again, we can reshare the link for the zip code file that needs to be downloaded if you are not able to open it from the email. The link is coming. This is the link to the zip code file. Everyone should be able to open it up. It may take a little minute to download because it is rather large. Yes, it is really large. Once you have it opened, go ahead and save it in your raw data folder, and then save a copy as an Excel file and bring it to work in the Excel file. Does anyone need any assistance with remembering how to save the CSV file in the raw folder? And saving the Excel file in their clean folder? Once you have it up and it's Excel, please go ahead, please share, let us know that you have it, or thumbs up, or post in the chat that you have it, and we'll go into it. Okay, it might be too large. So since some people are having issues with the file, what we'll do is we will go through it together.
Okay, and we can make a smaller file available for next time that has exactly what you'll need for part 2.
So let's go to the instructions for what we're gonna do. So we're gonna go through part 1 of this case study today and be prepared, and we'll prepare to address the second part in the next session. So everyone should have, or those who are able to open it, do you have it up? What I'll do is I'll share my screen and walk through the example again. So what we're going to do first, so everyone's aware, we're going to choose New Mexico as our state that we're filtering for. The zip codes we're going to use to filter for New Mexico are on the screen. And that's what I want us to do now. If anyone's having trouble or needs some assistance with figuring out how to filter for the zip code, when you have the main file open, you're going to filter your location. Your location is your zip code. So if anyone's trying to figure out where do I Thank you. Mary just posted in the chat the file for just New Mexico. And hopefully, let's see if that one opens up for everyone. It is a very large file. So sorry about that, Ben and Emily. Please let us know if this works. I didn't see many other thumbs up that others were able to open it either. All right, so for those who have the New Mexico file open or they have it open, I want you to go to the filter button just to take a look at the different outcomes within your measures. I just want us to talk about how many outcomes are available for each of those different, how many records are available for each of the different outcomes, just to see if we're getting the same number. So when you select your measures, when you select your category, which is column D, how many are people seeing for health outcomes? How many records do they see? You could place it in the chat or come off mute.
What is the filter again, Erica?
Health outcomes under category.
Mhm.
Yes, 4067. That's what you should be seeing. Everyone should be seeing that. And how about I'm just gonna pick another one, health-related social needs. How many records are you seeing for health-related social needs?
Erica, we had a request to share screen for this walkthrough.
Sure.
Do you have it up or do you want me to share screen?
I have it up.
Okay.
All right, you should now be able to see.
We
Okay.
see.
So for the categories is in column D right here. And so you would click the filter button here. I'm going to clear the filters to start over. And so I was wanting us to see how many records are available for each of the different outcomes. And so the first one we clicked on, I deselected all, and I just clicked health outcomes and wanted to know how many records were available. As mentioned in the chat, there are 4,067, and that number is seen here in the bottom of the Excel sheet. So when you're wanting to make sure you know that you have the right number, that's a quick way to do it. And then we did the same thing again for health-related social needs. So now I'm going to select this one and unselect health outcomes and click OK. And you see it automatically changes to just those that are within that category. And we see we have 2373. And so the next part, we're going to keep everything selected. I wanted everyone to take a look.
Chat, Mary, if you want to take a look at Braden has a question in the chat.
Oh.
Looks like you responded. Thank you.
Thank you. And so the next thing we're going to do is take a look at these measures, and that's where we'll wrap up today to see which ones are health equity informed for us in making decision making. And so I know we talked about a quick way to do it is to click on the measures, and I'm going to open them up like this just so that we can see the majority of them. I know a lot of the conversation we had earlier in discussion was all of the metrics aren't necessarily applicable in our respective areas, but sometimes that is the case as we're moving towards making changes and updating what these new metrics that we start collecting are in our respective areas. So knowing that we do have limitations now, which of these metrics and measures that you see here could be used for infection prevention and control? If this was the only data set that you were given, what do you think could you use to be could be useful in making a decision with what's available. And so I'm gonna just scroll through it. And feel free to place it in the chat what you think could be used as a metric, possibly if you were given a CDC Places data set and this is all you had with relation to infection prevention and control. I'm trying to get to the chat. Sorry about that. And so when thinking about or looking at TB as our example that we're using, one thing that we do know, for those who may or may not work in TB may know that, housing is a key issue when it comes to, housing is a key issue. Thank you, Emily. Maybe current lack of health insurance among adults age 18 to 64 years. That's also a great one. That's a great example. Could you expound for like 15 seconds what comes to mind? A quick one, if you're able to.
Sure, just thinking about lack of insurance being a barrier to folks seeking treatment, and especially the TB treatment is so intense that I'm certainly could be an issue. So
Okay, thank you so much for sharing. So I'm gonna go ahead and stop sharing right now as we're getting ready to wrap up. But that's the kind of mindset. Thank you again for sharing, Emily. Also, like housing instability, we know if you're surrounded by people or people that may be in or unsheltered currently or unable to be in spaces that they may be exposed to someone that has TB or they're living with someone. So that can also be considered a factor that you could use if needed to address this issue of IPC. So those are just two examples of ways you could think about addressing it if you're limited in your data set that's available to you to use. And so I'm going to hand it back over to Jennifer. Thank you all so much. I know we had a lot to cover and we didn't get through everything yet, but we do still have a few more sessions and we will definitely get to the heart of more of the issues.
Yeah,
we're not seeing
great.
the PowerPoint.
Let me try that again then. What are you seeing?
Your other screen, it looks like.
How about now?
Yes.
Okay, so any folks on the line who are participating in the NATRO Prepare demonstration project know that we like to end calls hearing a little bit from you to help us think about what were you able to take away from this? What would you like to see in the future? And just help us make sure that we can adjust for future sessions to make sure we're meeting your needs. And so I know this one was a really dense, heavy, I got lost halfway through, y'all, but it was a lot. And we're going to be excited to go into the next two sessions. But as we think about that, we're going to ask you 3 questions. And what you can do is, I see some of you are already figuring it out. You can use your phone to click on the QR code on the screen. Or if you want to go through the website, you can join at slido.com 2193 397. And we like to ask 3 questions. We like to ask, I like. So what is one thing you liked about today's session? I wish, what's one thing I would have liked to get out of today's session that I didn't get? And I wonder, so what's something that's still in my mind? So let's take a look at some of the responses as they're coming in first, so we can see what everyone's thinking or feeling. What's one thing you liked about today's session? Immediate help. Okay, practicing with the data sets, the pivot tables, interactive activity with Excel. All right, so y'all actually liked practicing. Then we are among the data geeks who like getting into it, using relevant data. Great, great. All right, let me give it just a second. All right, now my mouse is having an issue. I'm going to try to take us to the next poll and we'll see if it works. Thanks for sharing your thoughts here. All right. Now I wonder, what is one thing that could have been different in today's session? You take a minute to let us know one thing that you think you wish could have been different. This is actually supposed to say, I wish. So sorry if I'm confusing folks, but what is one thing you wish could have been different in today's session? More time, it's always the case. Slide shares ahead of time, that's a great idea. Yeah, we can definitely look at doing that. Shorter welcome session and longer breaks. Yep. More time for demonstration. In person, I know it's so hard to do it like this, especially when we can't see you. Yep. Okay, so it needed to go a little slower for some of the larger data sets. More time to download. Stronger focus on IPC. Okay, good, noted. All right, and then lastly, I wish or I wonder, what is one thing you wondered or are still curious about after today's session? What's still in your mind that you're curious about? And we can consider how to bring this into our next 2 sessions. More pivot table skills. All right. So anonymous, who everybody's anonymous because we're hiding your names, but if you still need help about how to have a cell count of a filtered column, maybe send a quick note to Mary in the chat right now, and she'd be more than happy to help you answer that question directly. Yep, deciding which data sets are most appropriate for IPC. Are we asking the right questions? These are great. All right, somebody is wanting to know if there's ideas or templates to better collect and track data from ICARs. So that might be an opportunity for us to crowdsource from all of you what tools or systems you might use. And the best visual tools to help with data analysis. Well, that is a perfect send out for us because our next session is when we're really going to start taking all of this information and putting it into practice to visualize a lot of this data to make it meaningful for our stakeholders who maybe we are having to justify the work we're doing and we're presenting it to a Board of Health or other community stakeholders, or maybe we are wanting to share it with long-term care facilities to help them see and engage in the value of, reporting to us as health departments. So there's lots of opportunities, and Mary is going to lead us through that session in a couple of weeks from now. I want to thank all of you for being here and giving us your time and trudging through. And I'm going to ask you all, before you hang up, put in the chat, what is one word that you're leaving today's session with? Just one word. Think, feel, act, whatever it might be. Communication. Awesome. Well, thank you, everybody. I hope to see you here in 2 weeks. We'll send a follow-up email with information for everybody. Appreciate your attendance, and we'll talk to you soon.